So the first thing I'm going to do is I'm going to wash my hands quick. Okay, now I'm going to compare my physician's order sheet to my MAR. So we have the right patient, Aaron Fletcher. The right date of birth is June 18th, 1960, and he's 58 years old. The right phone number is 987-654-321, 987-654-321, and the right doctor is Dr. Saunders. Okay, and the patient is allergic to penicillin. So now I'm going to do my first check. So we have the right drug, metoprolol. The right dose is 12.5 milligrams. The right route is per aura, and the right frequency is 2 times a day, and it's going to be administered at 0900 on April 13th, 2022. The next drug is metformin. The right dose is 500 milligrams. The right route is per aura, and the right frequency is twice a day, starting at We're going to be giving it at 0900 on April 13th, 2022. And finally, we have timolol. That's the right drug. The right dose is 0.5%. The right route is going to be intraocular. We're going to be giving 1 drop to the right eye. The right frequency is once a day, and we're going to be administering it at 0900, starting on April 13th, 2022. Okay, now I'm just going to explain why I'm giving all the drugs. Okay, so the first drug I'm giving is metformin. The mechanism of action is it inhibits glucose production in liver. It sensitizes insulin receptors in target tissue by increasing glucose uptake and slightly reduces absorption in the gut. The reason why I'm giving this is to lower blood glucose, and it improves glucose tolerance in patients living with type 2 diabetes. The adverse effects include headache, lactic acidosis, and nausea. The safe dose is a max of 2.55 grams a day. You can give 500 milligrams 3 to 4 times a day, or 850 milligrams 2 to 3 times a day. Nursing implications I'll need to check is their kidney function. We cannot give them the drug if their kidney is not functioning because it can go to toxic levels. And I need to check their hypoglycemic reactions. So I need to check for sweating and anxiety. The next drug is timolol. Its mechanism of action is it's a beta blocker that decreases aqueous humor and increases outflows. The reason why I'm giving this is to treat glaucoma by decreasing pressure in their eye. Adverse effects include insomnia, dizziness, and fatigue. The safe dose is a max of 1 drop in the affected eye twice a day. And nursing implications include assess for systemic absorption, so look for low blood pressure, and if they have a headache. Okay. And finally, we have metoprolol. The mechanism of action is that it blocks cardiac beta-1 receptors that decrease heart rate and contractility, which lowers cardiac output, and it suppresses reflex tachycardia. The reason why I'm giving this is to reduce hypertension. The adverse effects include hypotension, insomnia, and dizziness. The safe dose is a max of 200 milligrams a day, twice a day, and so a total of 400 milligrams a day. Nursing implications are to check the blood pressure because we can't give the drug if it's too low, and to check their blood glucose because metoprolol can mask the signs of hypoglycemia and diabetes mellitus. Okay, so now I need to check all the drugs to make sure that they are not expired and that they do not have penicillin in them. Okay. So we have metoprolol here. It is not expired and it has no penicillin in it. Next we have metformin. It is not expired and there's no penicillin in it. And finally we have timolol. It is not expired and there's no penicillin in it. Okay, so now I'm going to start making my drug cards. I'm going to bring this over here. These ready. I need 3 cards. Alright, so I'm going to start with metoprolol. Okay, so we have the right patient, Aaron Fletcher. The drug name, metoprolol. The dose is 12.5 milligrams. And the volume is going to be half a tab. So there's a total of 25 milligrams per one tab. The date is April 13th, 2022, and the right time is 08:45, and my signature and UMSN2. Okay, so now I'm going to cut the drug. But first, I'm just going to wash my hands again so I don't have to touch it. Okay, so I have my metoprolol.
I had to pause so many times because I was coughing.
And then the next day, like, we were like way over, so
Okay, we're gonna throw that drug out.
I felt so bad. I was like, but I had like so many slides. So, metoprolol is an antihypertensive beta blocker. Metformin is antidiuretic and
Okay, we're gonna cut that in half.
Oh,
And I'm gonna take the better half.
Production and increases.
And I'm gonna throw this one out in the drug container.
That was, like, that, I think, was really the only thing. Like, you washed your hands, like, maybe you could realize you wash your hands.
Then I'm gonna put this to the side. And we are not gonna put that away just yet. Next we have the metformin.
How they did metformin and metoprolol, they sound so similar.
I know.
And we're gonna put the right patient.
Let me know when you're ready.
Metformin. And we're going to be giving a total of 500
Hi, my name is Callie, and this is my
milligrams. And so we're going to be giving 2 tabs.
physician's order sheet with some more.
There is 250 milligrams for one tab. And the date is April 13th, 2022, and the time is 08:45. And my signature and UMSN2. Okay, now we're going to administer or put that in the container.
The next one is metformin, 500 milligrams. Metformin, 500 milligrams.
Okay, we have a total of 2 tabs there, so I'm going to put this to the side for now.
At 9 a.m. He has not received that today.
And our last drug is Timolol.
The last one is Timolol, 0.5%.
Okay, and I'm going to put the right patient, Aaron Fletcher.
1 drop to the right eye, once daily.
Drug name,
9 a.m. He has not received
Timolol.
it today, so we know that
The right dose is 0.5%. And the right volume is 1 GTT, so 1 drop in the right eye. Okay. And the date is
we have our metoprolol.
April
500
13th,
milligrams per oral.
2022.
25 milligrams per oral.
And it
It's
is
not expired. So we know that we
08:45,
have to
and my
give
signature,
half of the tablet, so I'll get that ready here.
and UMSN2. There we go. Okay, now we have all of the drugs here, so now I'm going to do my second check. Okay, so I'm going to start with metoprolol. Okay, we have the right patient, Aaron Fletcher, and the right drug, metoprolol, and the right dose is 12.5 milligrams, and there's 25 milligrams in 1 tablet, so we had to cut in half. So that makes sense, I have 1 tablet there. And the right route is per oral, again, makes sense, I have tablets there. The right frequency is twice a day, and I'm going to be administering it at 0900. Okay, so I'm all finished with that, so I'm going to put that away. I'm going to put that back. Next, I have my metformin. Okay, so we have the right patient for Aaron Fletcher. The right drug is metformin. The right dose is 500 milligrams, and there's 250 milligrams per tablet, so I have a total of 2 in there. The right route is per oral, which makes sense. I have 2 tablets in there. The right frequency is twice a day, and we're going to be giving it at 0900 on April 13th, 2022. And I forget if I mentioned it that this one's also going to be administered. Metoprolol is going to be administered on April 13th, 2022 as well. Okay, so we're all done with this. So I'm going to put that away and put my drug label back there.
Hi, I'm Callie.
And last is the Timolol. So we have the right patient, Aaron Fletcher. The right drug is Timolol. And then we have the right dose is 0.5%, 0.5%, 0.5%. The right route is intraocular, and it's going to be going into the right eye. This makes sense. I have eye drops here. And the frequency is going to be once a day, and it's going to be started at 0900, and it will be administered by 0900, and it will be administered on April 13th, 2022. Okay, so I'm going to put away my physician order sheet because that is confidential. And now I'm just going to make sure I have everything before I go into the room. So I need cotton ball, water,
And the last one is Timolol 0.5%.
and I need 2 pairs of gloves.
One drop for the right eye, one drop for the right eye, once daily, at 9 a.m.
So my drug card, my bar.
Next, I'm going to wash my hands, and I'm
Ready
going
to
to
go
get
in.
ready.
Okay. So as I'm entering the room, I'm going to wash my hands. And I've done my first safety check. Everything looks good in here. Hello, how are you? My name is Isis McMillan. I'm going to be your student nurse today, and I'm going to be administering a few drugs. But first, could I take a look at your name tag? Awesome. Can you tell me your name? Aaron Fletcher. Okay, that's what I have as well. And what's your birthday? June 18th, 1960. Awesome. And do you have any allergies to penicillin? That's what I have as well. Okay, I'll put that back over. And is it okay if I lift your bed a bit? Raise the bed? Okay. Okay, that should be good. So first I'm going to do my last drug check over here, just to make sure everything is correct. Okay, whoops. Okay, so I'm going to start off with the first one at the top here. The right patient is Aaron Fletcher. The right drug is metoprolol. And the right dose is 12.5 milligrams. So I need half a tab. I have half a tab there because there is a total of 25 milligrams a tablet. The right frequency is twice a day. And it's going to be administered at 0900 on April 13th, 2022. And it's per aura if I forgot to mention that. The next drug is metformin, and it's for Aaron Fletcher. And again, it's metformin. The right dose is 500 milligrams. So I needed a total of 2 tablets because there was only 250 milligrams a tablet. And the right route is per aura. That makes sense. I have tablets. And the right frequency is going to be twice a day, and the right time is going to be 0900 on April 13th, 2022. Okay, that's perfect. And the last drug, we have Timolol there, so that's the right drug, and the right patient, Aaron Fletcher. The right dose is 0.5%. The right route is going to be intraocular in the right eye. Okay, and I have 1 drop in the right eye there. The right frequency is going to be once a day starting at 0900, and it's going to be on April 13th, 2022. Okay, perfect. So now I'm going to explain to the patient why I'm giving the drugs. So I'm going to be giving you 3 drugs today. The first one is metoprolol, and it's going to help treat your high blood pressure. And you're going to want to monitor your blood glucose, so your blood sugar, to look for signs of hypoglycemia, which is low blood sugar. So you're going to look for signs of being shaky or sweaty, and also you're going to want to report signs of low blood pressure. That can be dizzy or nausea. Okay. And the next drug I'm going to be administering is metformin. This will help your diabetes mellitus by lowering your blood sugar. This does not cause weight gain, and avoid drinking alcohol and any over-the-counter such as Tylenol. And the last drug I'm going to be administering is Timolol, and that's an eye drop. So that's going to help treat your glaucoma by decreasing pressure in your eye. And it is only for your eyes. And do not touch the tip of the dropper when you're administering it yourself. And make sure you're not wearing contact lenses when you are administering it. So I'm going to have to do some assessments before I give you the drugs. So for Timolol, I need to assess for systemic absorption. So I need to check to make sure your blood pressure isn't low. I'll check that right now. Okay, your blood pressure isn't low. And do you have a headache? No? Okay. The next thing, I checked his kidney function earlier and everything's working fine. And, okay. And then for metoprolol, I already checked his blood sugar and it wasn't too low, so I can administer the drugs. And I also need to check your blood glucose, because if it's low, this can mask the symptoms of it. So I'm just going to quickly check. Okay, it is not too low. Okay, do you have any questions about the drugs? No? Okay. Okay, I'm going to administer the drugs on the other side because I need to give the eye drops on that side. Okay. Oops. Okay. And I'm going to wash my hands again before. Okay. So I'm going to get this right here. Did you swallow? Perfect. He swallowed. I'm going to give the next drug. Did he swallow? Okay, he swallowed. And next I'm going to give the eye drops. So I need to wear gloves when putting them on. In the cap, I'm going to put it on the side. Just like that. Okay. So I'm going to have to pull that down. Perfect. I'm going to hold the cotton ball there for about 1 minute. Okay, that's good. And I'm going to put the cap back on. And I can take the gloves off. Okay, so I'm going to give you the call bell here. If you're not feeling well or you just need me, please call that. But I will be back in 30 minutes to reassess. And would you like your bed lowered? Okay, yeah, I'll do that because that'll be a bit safer. Okay, so I've done my last safety check. Everything looks good. So, and I'm also going to sign the MAR. Okay, with my initials. And UMSN2. And with the time. Oh, shoot. Okay, then I'm going to sign this one too with my initials. UMSN2 and the time 0900 and my initials here too. UMSN2 and with the time. Okay. So I'm going to be leaving the room. I'm going to wash my hands again. Okay. So I assessed his blood pressure and it wasn't too low, so I could give the medications. And his blood sugar wasn't low either. And I'm hoping to see that his high blood pressure will go down. For Timolol, I checked for systemic absorption. There was none. He didn't have a headache. So I'm hoping to see the pressure in his eye will decrease. And for the metformin, I checked the kidneys function and they were fine. And his blood sugar again wasn't too low. And I'm hoping to see that his blood sugar will decrease.